Next session is a continuation of the sort of lightning sessions that we had just then with REIN.
Thank you, and thanks for having us here today. I think this is such a great idea. Look, REIN, the Research Engagement and Impact Network, is a pretty simple idea. There's a bunch of people at the university who are interested in research that has great benefit, and engagement with the public outside of academia. Let's get those people together and form a kind of grassroots network. So let me just find a way to go forward. I'm from the Faculty of Science, for example. My colleague Kirsten is online. She is from one of the centres at the university. And there's a few other people who manage this, but essentially it's a loose network of members. We are trying to bring together people to develop knowledge, skills and practices around this idea of research engagement and impact. Research engagement, research impact, that they are terms that have different meanings at different levels. The government, the university, the people that work at the university have different ways of doing this, or understanding this. So a peer-to-peer network is really valuable in this space, right? A community of practice allows us to share these meanings and these understandings. We are looking for opportunities to build capacity and build our capabilities around this. There's a lot of people who are got questions. And there's a lot of people with a real depth of expertise and understanding. We work as a safe space. We have a lot of people from a lot of different areas, both academic and administrative, because we feel in a university you can't have one without the others. We've got a lot of support, for example, from the library. There's a lot of people in the library who are really keen to help with this space. And we're trying to build knowledge, we're trying to build good practice. And that's hard. It's hard when you're just a group of people who are doing this kind of on top of whatever else you do. We share knowledge, we share practice, we share ideas. That's one of the main things we do. People come and they say, "Oh, have you seen blah? This is really useful." And it might be an external report, or it might be a tool that they've developed. We bring in people sometimes from outside to talk, to give us different views. We build links, both personal links mostly. At these meetings, it's like, "Oh, I didn't know that your area was also working on this. Could we have a coffee together later?" That kind of thing. That for us is kind of excellence personified in this space. And so we're a facilitation group. We hold monthly meetings. We alternate between Zoom and face-to-face, and that is one of the major activities we do. And it sounds really simple, but within the university, it can be hard to break down silos. It can be hard to get across different areas. So what I wanted to do today is just in the spirit of essentially co-design, so to speak. I want to ask you or throw out a challenge around how have you found ways to create pathways to social impact? What do you understand as the different groups, the different activities that work in this space? Because we struggle with this. It's at the university, even though we've got a million ways to communicate, we find it hard to get a message across. Right? We find it hard to find the time to do this. We find it hard to measure how well we are doing. And these are not problems that are unique to us. But there's chat, there's Q&A. Or you can even just unmute and just say, "Look, this is my experience in this space. What's good practice in this space? How can we take those things and take them forward?" I guess my question is, how do we work to bring this to the attention of people within the university in a much more clear and effective way? And there's a lot of expertise in the room right now. Just listening to the last presentation, it seemed like there was a lot of people who knew what they were doing.
Thank you very much, Jonathan.
Thanks. Hi, everyone. Great to be back, and I hope you've all had a wonderful day. So yeah, I'll just take a few moments to tell you about MISCH. I'm just going to pop in the chat a link to our node in the MISCH rather than putting up another slide. So yeah, MISCH stands for Methods and Implementation Support for Clinical and Health Research Hub. It's a bit of a mouthful, but what it is essentially is a research hub. It involves a lot of different nodes in there where people can offer support to researchers in the university, depending on what methods support they might need. So there are people that work on biostatistics, and there are people that work on health economics, and there are other areas as well. I work in the co-design and implementation node. And so it's myself and it's Professor Kathy Vaughn. And Kathy is the director of the Nossel Institute for Global Health. I work in the Gender and Women's Health Unit, which is in the Nossel under Kathy's direction. Previously, both Kathy and I were in the Center for Health Equity before Kathy took up her position with the Nossel. So we collaborate in the MISCH, and we provide support internally to researchers who are looking to include co-design approaches or other types of participatory approaches. It doesn't have to be co-design, but co-design is one of the areas that we can provide support with on any kind of health or social research project that you might have. We do work in the Faculty of Medicine, so we do have quite often a health focus in our work, but we can work with other faculties across the school as well. And we work with people externally who need support with co-design projects. And often we're going with people on grant applications as well. So NHMRC or MRFF grants, if you want to have a co-design or participatory research component in there, we can collaborate together on that as well. And essentially how it works is if you're interested in working with us, you can go to that link. There'll be kind of a collaborate with us button somewhere in there, I think, or on the main MISCH node page, and you can go into a portal and just enter some information about what you're working on. I think one of the things to highlight there is the earlier you come to us, if you want to collaborate, the better. So you don't have to have a fully formed idea or a research plan put together already. In fact, it's better if you're really in the very early thinking stages, so that we can work with you around what you might want to do. And the way that we work can vary from just providing background information and support to help you set up co-design projects through to running that component of your research with you, and following through the implementation and evaluation stages as well. So different ways of working together, but yeah, feel free to get in touch if you're interested in finding out more. Thanks.
Okay, great. So hi everyone, I'm Phoebe Quinn. As Cara said, I'm in the School of Population and Global Health, and I'm a research fellow and also a PhD candidate. And I just wanted to quickly talk to you today about this tool called Polis, which we can think about in a bunch of different ways, but one way of thinking about it is as a participatory survey tool, which can potentially be quite useful in co-design processes. So especially that's if you're wanting to involve large groups of people in a conversation about what to do about an issue, and especially if you're wanting people to be able to participate remotely or asynchronously. And I think the organisers of this event will also be running a Polis conversation following on from the survey about co-design that some of you will have completed. So before I go any further, I'd like to acknowledge the traditional owners of the lands that I'm on, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders, past and present. So a core part of co-design is often facilitating group discussion and sometimes decision-making as well. And in thinking about how to do that well, how to facilitate those collective discussion processes, there are a few ideals that we generally want. So one is that relatively large groups of people have an opportunity to provide input. That's not 100% necessary all the time, but often it is desired. That there's a low burden of participation, both from the perspective of the participants or co-designers and the people who are running the process. That when people do participate, they have a fair chance to be heard, and that they can express their ideas ideally in their own words and raise new ideas or issues. And also that what they do express can be synthesized in a way that's reasonably rapid and robust and ideally transparent as well. And finally, that synthesis actually surfaces the best response on behalf of the collective. And obviously the word best is doing a lot of work there, but one way that we can think about it is this idea of rough consensus. So ideas that most people across the process were happy with, even if it's not necessarily everyone's absolute favourite, everyone can kind of live with it. So with a lot of the time, we sort of have to make trade-offs between those ideals because of the realities of the tools that are available and the methods that are available. So for example, with meetings or sort of focus groups, things like that, they can be great for people expressing themselves richly, but not so great for having large groups of people take part. I'll just quickly whiz through this, but surveys, closed-ended surveys are kind of the flip side of that, where you can have it at larger scale, but it's less rich. You can have free text surveys, but then you end up with quite a lot of qualitative data, and it can be challenging to analyse all of that. And another option is social media discussions, or that sort of interactive online discussions. But a lot of the time, the way these are set up, it doesn't really bring the best ideas to the surface necessarily. And a lot of social media discussions instead raise or sort of highlight points of disagreement more so than points of consensus. So Polis is a tool that has been kind of heralded by people who have used it and people who have developed it as potentially helping to get around the need to make some of those trade-offs, trying to kind of get the best of all of those worlds. So that's a pretty powerful potential. And so one of the things that I'm looking into in my research is, to what extent does that actually bear out, and yeah, how can it be used in processes like co-design or democratic decision-making? So essentially Polis is an online tool that is designed to support large groups of people to discuss issues in their own words and synthesize that in real time to help understand patterns of agreement and disagreement. I should note that it doesn't use natural language processing or large language models, although that can be used, I guess, in conjunction with it potentially. But it was developed in 2011. It has been used most significantly within Taiwan in their mainstream system of government, but also by a range of organisations like local governments and others across the world. And we've set up a version of Polis at the University of Melbourne last year. So that's called Polis at UOM. And we're actually now in the process of trying to get that scaled up so it can become a platform that's available for any staff or students at the uni to use. Currently, it's restricted access. So if you're interested, feel free to get in touch with me and we can discuss what might be possible. So basically how it works is that you set a single topic or question for discussion. So this is an example screenshot from the conversation that we ran last year using Polis at the University of Melbourne about what to do about the staff air travel emissions issue. And so people, to participate, they get the link to the conversation, they go on there and they see one by one a comment that somebody else has made in response to that question. And they either agree, disagree, or pass. And then the next comment pops up and the next one and the next one, and they can keep going for as long or as short as they like. And they can also put in their own comment if they want to, which then goes into the pool for other people to in turn agree or disagree with. And it synthesizes that data in real time and identifies opinion groups or clusters of people who tend to respond in similar ways to each other. And it also generates an automatic report that lets you explore all the data in a lot of detail, including this chart that I like, which you can see the little black dots, if you can see them on your screen. Each of those represents a comment, and if you hover over them, you can see on the far left are the comments that had a high degree of consensus across the conversation, and on the far right are the more divisive statements. So that's the basics of how it works, and I will leave it there. Thanks so much.
Hi everyone, my name is Olivia and I'm a Senior Research Fellow at the Centre for Digital Transformation of Health at the University of Melbourne. And I wanted to just take a few moments to introduce you to a new initiative we have at the university called the Validitron, and talk about how the Validitron can help you with co-design, and also why co-design is so important in digital health. So if you are a researcher or a clinician in any area of medicine or health sciences, you probably already have a great idea about how technology can help solve one of your clinical problems. You might be thinking of an app or a wearable or a patient portal or something embedded in the electronic medical record, or maybe a machine learning algorithm. But what we know is that creating digital health tools is really hard to do, and many digital health interventions actually fail when they're introduced into the healthcare setting. The Validitron is a new platform that provides researchers and clinicians like yourself the physical and virtual space, as well as the digital health expertise you need for your project to ensure that your tool succeeds. We take users along this evidence-backed pathway and support you at all stages to be generating the evidence that's required in order to ensure that your tool succeeds. So we understand what makes digital health tools fail, and we work with you to de-risk, optimize, pilot, and evaluate. And these are some of the kinds of questions that we can ask. And of course, co-design is an important part of this. Co-design happens early on, and we work with you, with your consumer stakeholders and your clinician stakeholders, to ensure that you've got the data that you need for your pilot tool. This is what our physical space looks like. We have 3 simulation labs you can use: the home area, the GP office, and the hospital setting. And again, the things you can test out in this are designed to ensure that you have the data that you need around how your tool is interacting in the healthcare setting environment. We also have a virtual space that we call the sandbox, and this is a place where you can access both real and simulated infrastructure and information systems. So say, for example, with your digital health tool, you have data from an app, and you need that data to interact with the electronic medical record. That's something that you can prototype and test out in the sandbox. And then the other part of the Validitron is the people. So we have experts in digital health who work with you really closely along the way to fill the gaps that you might have in your project when it comes to the development and testing of your tool. And of course, again, co-design is a really important part of this, but it's not the only methodology that we have expertise in and can provide and make available to you. So at the Validitron, we work with a whole range of people, including MDHS researchers, our MAC partners, lots of other Australian university researchers, and all of our Victorian health services. So if you're a researcher or a clinician and you have an idea, or you have a product already that you want support with, come and speak to us. We can offer a range of different support. We can also help you with writing a grant. If you're going for a large grant or just a small application and you just need some digital health advice or expertise, the Validitron can help you. Thanks very much. Looking forward to speaking to you.